No one becomes an alcoholic because a liquor store opened in the neighborhood. But the interesting thing is, at least in the States, people are willing to accept the fact that kids become obese because there's a McDonald's nearby. We looked at some of the consequences of alcoholism as they relate to the risk of child abuse. And what you see here is 1, 2, or 3 alcoholics in the household and the likelihood of various forms of child abuse. Emotional child abuse, that is to say recurrent humiliation, goes up rather dramatically. Physical abuse goes up rather dramatically. And contact sexual abuse goes up rather dramatically. Once again, underscoring the interrelationship of all of these issues. We looked at self-acknowledged injection drug use. Self-acknowledged. And what you see here is that as the A score goes up, the likelihood of being a self-acknowledged IV drug user goes up rather dramatically. I believe this is a 1,250% increase here. And if you go out to A score 6 or higher, you're wildly off the scale, because at that point it becomes a 4,600% increase in the likelihood of an A score 6 or higher individual becoming an IV drug user later in life as compared with an A score 0 individual. Those are mind-boggling numbers. I mean, you think, you read in the newspaper whatever the cancer scare of the week is. God knows what increases prostate cancer by, 30%, etc. Here we're talking about hundreds and thousands of percent. Epidemiologists at the CDC tell me that numbers of this magnitude appear once in a career for professional epidemiologists. There's another way of looking at this, and that's using the technique of population attributable risk. Although this is clearly pretty bad on an individual basis, how big a piece of the overall problem in the population can be attributed to adverse childhood experiences. When you look at alcoholism, you can account for about 2/3 of it. When you look at drug abuse of all forms, you can account for about half of it. When you look for intravenous drug use, you can account for about 3/4 of it by adverse childhood experiences. This then brings to the forefront what we might call a public health paradox, namely that many of our most common and intractable public health problems are unconsciously attempted solutions to personal problems that date back to childhood and that are buried in time and concealed by time, by shame, by secrecy, and by social taboo. Nice people don't ask about these things, and certainly no one's going to bring them up spontaneously. And the result of that is really that monstrous problems are allowed to go undetected or misunderstood. The functionality of dysfunctional behavior is a huge change in direction of understanding. Interesting woman. She's the sister of the first patient I showed you. And you might say, well, my God, you have 2 women over 400 pounds in the same family. It certainly must be genetic. On the other hand, speaking English runs in that family. That is to say, speaking English is familial, and yet no one jumps to the conclusion that therefore speaking English must be genetic. So the fact that something is familial certainly raises the question, but it does absolutely nothing to answer it.
As far as being molested, that's stuck with me all my life. It's still in the back of my mind. I am in therapy. I too suffer from depression. Yeah, the most traumatic was my mother, losing my mother, most definitely.
Which had the most to do with your putting on so much weight?
That's a hard question. I think I started getting heavier and heavier after my father and mother divorced. But then I started really getting heavy after the molestation. And I would try to take it off, and then I would just gain it all back and then some.
Gain it all back and then some. The insight is in the and then some. Because it really, what she's inferring is the protective aspects of it. Both she and her sister were molested by the same grandfather. And in other areas in the interview, she makes it clear that not having a father present and then losing her mother really made her particularly vulnerable. Back to the issue of the complex interrelationship. She's talking about depression. Most people speak of depression as a disease. Many people say it's genetic. Some say it's due to a chemical imbalance. Here's an interesting thought. What if depression were not a disease? What if depression were a normal response to abnormal life experiences? Here's the evidence for that. Looking at self-acknowledged chronic depression, again, recognizing that we're probably understating it because not everybody wants to acknowledge chronic depression, matching it against a score on the horizontal axis, prevalence in women in red, men in yellow, you see that at a score of 4 or more, you're bumping 60% prevalence for chronic depression. That's rather striking. But isn't there a genetic component? Yeah, absolutely. I mean, here's some space for it to fit into. Are there not biochemical abnormalities involved? Absolutely, there have to be. They're not causal, though. They're necessary intermediary mechanisms. Let me give an illustration because there's an important idea there. Let's say that someone were to release a rabid wolf into this room and shut the door. We would all be very nervous. If some budding neuroscientist wished to study anxiety, might grab blood specimens from us and find that our adrenaline levels were severely elevated. And yet none of us would say that we were anxious because our adrenaline levels were high. We would understand implicitly that that was merely an intermediary mechanism, not a basic cause. And yet many people speak of depression as though the neurochemical abnormalities are the basic cause rather than the necessary intermediary mechanism. It's certainly easier to speak of it that way. It's more comfortable. You don't have to deal with threatening reality. If you have any doubt about the validity of self-acknowledged chronic depression, then we'll look at self-acknowledged prior suicide attempts. I mean, if there's anything that people don't talk about, it's this. And what you see here is that we've moved from an arithmetic relationship to an exponential relationship. I mean, this thing really zooms. And if you go to a score 6 or more, once again, you're wildly off the scale, because at a score 6 or higher, there is between a 31 and 50-fold increase in the likelihood of attempting suicide later in life as compared with an a score 0 individual. That is to say, a 3,100 to 5,000% increase in likelihood. And then still, because we work in a closed system where drug benefits are part of Kaiser Health Plan, people don't go out and spend their own money when they get it free in our pharmacies, we can look quite reliably at pharmacy utilization 50 to 60 years after the fact. So looking at ACE score and the rates of antidepressant prescriptions 50 to 60 years later, you see the same stepwise proportionate relationship.